Hey, welcome back everybody. Thanks for joining us in this first episode of our hip injury series. So in this series, we're going to look specifically at the hip and some surrounding areas that are commonly associated with the hip and hip injury. But for this first episode, at least, this introductory episode, we are going to be just highlighting some of the most common hip injuries, the anatomy of the hip and some of those surrounding areas. We're also going to talk about and just briefly review some of the common terminology and things that we've talked about in previous videos in regards to injury. We won't go into too much detail there just because I already have that information out there and you can find that in previous episodes. Finally, in this episode, we're going to talk about some of those red flags that you should look for in terms of when maybe you should start thinking that you have some type of serious injury. Hang in there with us, and I hope that this is going to be yet another beneficial injury series. So you may be someone watching this series, watching this episode just for the sake of watching it, and maybe you don't necessarily have a hip injury. If you're someone who does, then you kind of understand our intent behind making this. If you don't, maybe to put it in perspective for you, I chose to do this series on the hips because the hips and your core form the most proximal segment or the most proximal basis of your kinetic chain. Now that's a lot to chew on. There's a lot of words I just threw out there. And what I mean by that is the hips and the core combined form the foundation of most all rotation-centric movement, such as disc golf or golf and things like that. If you talk to any form specialist, any type of coach working out there, they will agree, they will tell you that the origins of good, strong, healthy movement start in the hips and with the core. So if you're a person who has an injury to either one of those, namely the hips for this series, you know that this can and will take a toll on your game if left unchecked. So that is why I've chosen to focus on the hip for this series. So let's talk about some functional anatomy at the hip. Before we dive into that though, I want to identify that when we're talking about the hip, a lot of times, especially in physical therapy, we refer to the hips as being a part of this complex, the lumbopelvic hip complex. So it's part lumbo, it's part of your lumbar spine. Pelvo involves your pelvis, which is kind of funny because you'll see in a little bit that your pelvis really is just a part of your hip. And then your hips. And all those pieces together form that lumbopelvic hip complex. And the reason that we call it a complex is because they have different parts or components that all work together to perform certain tasks. Before we get too involved with the soft structures that are involved in the hip, much like the shoulder, there are a lot of parts and there are lots of things that can be injured and lots of little things that can go wrong and lead to injury or pain. Let's talk about some of those bony structures first. This is half of a hip joint. Kind of, you imagine doubled on this side, kind of forms a bowl, and then you've got the top portion of a femur, and this would be the right femur and the right portion of a hip here. And I know that because this is your iliac crest here. So this portion here is your ilium, kind of a big elephant's ear. This front portion here is your pubis, or pubic ramus, and then if you turn it back, so we're looking at the back side now, here's your ischial tuberosity, and your ischial tuberosity is actually your butt bone. So when someone says you have a bony butt, everybody's got a bony butt. Some people just have a little bit more padding. And then we're gonna look at the femur here. So you got your greater trochanter, this big bump out here. It's a site for muscle attachment, covered by a bursa. Can give a lot of people trouble. We'll talk about that later. Lesser trochanter is on the inner portion here. That's also a site or attachment for muscle. If you look closely, they've kind of cut away the joint capsule and you can see the head of that femur there with its cartilaginous coating there, kind of for articulation. And inside the joint itself, this is called the acetabulum or the hip socket. It's where that femoral head sits and fits in there. It doesn't really have, it's got some of the ligaments cut away, but for ligaments and muscles, we're gonna take a look at some pictures and I'll bring those up now. So we're actually gonna start in soft tissues at the core. And you may be asking yourself, why the heck is this dude covering the core when I'm here to talk about my hip injury? Well, your core works in conjunction with your hips to provide stability to your overall trunk. So if one is acting out of order or not acting in the right order or not acting together, it can lead to a lot of problems. And some of these core muscles, or all of these core muscles, have some type of either attachment directly to the hips, or they share some type of fascial or tendinous junction. So if you look at some of the highlighted marked structures, first you'll see the transverse abdominis. That is a very commonly and I think misproportionately diagnosed problem area for people with low back pain. We'll talk about that maybe in a separate video about low back pain, but that works for core stability. And you've got your internal and external obliques. Those help you with breathing actually, and then they also aid in some rotation of torso over the trunk. And you've got your rectus abdominis. That's the one that everybody wants to train and everybody thinks, you know, is going to make you real strong. It'll help you flex your trunk or sit up really well, but isn't necessarily the greatest core muscle to work. Now we're going to take a look at some of the spinal muscles, and again, much like the core, you're like, hey dude, I'm here to talk about my hips. Well, these spinal muscles again help for stability of the spine, stability of the trunk, and some movement that occurs about the hip, moving the trunk about the hip. They also have attachment sites at the hip, or again, they share some type of tendinous fascial attachment there at the hips. First, you've got your semispinalis, generally will not lead to any hip injury. Multifidus, this guy right here, this is a very commonly atrophied and wasted muscle in folks who have low back pain. It provides stability in the back. If you are someone who has pulled their back frequently, or you feel like you've pulled a muscle in your back, you're more than likely pulled another muscle called the quadratus lumborum, we'll get to in a minute. And that's because your multifidi, a certain multifidus muscle, is not doing its job and providing that stability in the spine. Not necessarily one that's going to come up too much when you talk about the hips. And we just mentioned the quadratus lumborum, where you've got a couple of those on either side. Those are big movers. Those are for side bending and rotation. A lot of people have weakened multifidi or underutilized multifidi for one reason or another. It could be our sedentary lifestyles. It could be a lot of things. Either way, a lot of times we ask our QLs to do the work of those multifidi, and they get really angry and they get tight and we pull them and all kinds of stuff. Then you have your rector spinae. Those also are chronically tight muscles, which can become sore. It's not necessarily an injury, it is a state of muscle contraction that can become bothersome or painful. And that can lead to some hip dysfunction. If you've got real tight QLs or real tight erector spinae, and you don't have that truncal motion like you should, you may go looking for that motion elsewhere, try to make it up elsewhere, such as in the hips. And then you've got your latissimus dorsi. Brings your arms to your side, brings your arms back, and helps you internally rotate those arms. And while the lats may not be directly related to the hips as much as some of the others, you can believe though that if your lats are tight, oftentimes you can't get really good overhead motion because your arms are restricted. And if you can't get really good overhead motion, you may try to find that motion by excessive hip extension or some other types of substitutions or adaptations that could lead to hip injury. So I don't want to totally rule out the latissimus dorsi as a source of hip injury, just not super common. And then we're looking directly at the hip musculature. Obviously you got the glutes. Everybody knows about the glutes. You got glute max, glute med, and glute min. Glute max, that's the big fella on the back, or and a lot of dudes, especially as you get into middle age, those big guys start to kind of go away, don't they? Yeah, and that's because kind of over time we compensate and find ways to not use them, and then that's why later on we have some back pain. But we'll get into that into another video. But glute max is the big fellow on the back, helps for hip extension and external rotation at the hips. And glute medius is the smaller and deeper, or the middle of the three muscles. And that helps for abduction of the hips and internal rotation, some internal rotation, depending on the fibers. And then glute minimus, that's the littlest fella of the glute triplets. And that's for abduction and internal rotation of the hip. Now we're gonna get into a cluster of muscles that are really specifically external rotators at the hip. There's a really, really good acronym, an easy acronym that I learned in PT school when learning these guys, especially for cadaver lab. And that is PGOGOQ. P stands for piriformis. The first G stands for superior gemellus. Then you got your obliquus externus, and you've got inferior gemellus, and you've got obliquus internus, and then the Q finally stands for quadratus. And those are all really tiny, almost like Vienna sausage size muscles that reside under your glutes. Really tiny little muscles in your butt, all help in external rotation of the hip. The one that has been the most problematic for folks is piriformis. And it's the most problematic for folks because anybody that said that they've had piriformis syndrome or issue with the piriformis really mean that either that muscle is irritated and so it's pressing on the sciatic nerve, or something else, because true piriformis syndrome, which is the passage of the sciatic nerve through the piriformis muscle. That's very rare. So anybody who has been diagnosed with or says that they have piriformis syndrome, they probably don't. I mean, I wouldn't fight them about it, but it's not very common. And then we look at some other muscles at the hip, the hamstrings. I debated on whether or not to list these. They do insert at the ischial tuberosity along with glute muscles. So they share an attachment site with some of the big hip muscles. They really only kind of assist in hip extension. You really don't want, if you're looking for true hip extension, you really don't want your hamstrings doing that. You want your glutes doing that, but they do assist in that. And otherwise, yeah, they bend the knee up. But they are helpful in kind of hip stability. So if you got weak hamstrings, you may have some hip instability. Then we talk about our TFL, the tensor fasciae latae. It's the pocket muscle, and that helps with hip flexion, a little bit of abduction, and then internal rotation at the hip. And you've got your grouping of muscles that are known as hip flexors, your iliopsoas, your rec fem, sartorius, and those all help with hip flexion. Some of them help in external rotation, abduction. Iliopsoas is actually composed of two different muscle bellies, the iliacus and the psoas major, and that is a muscle. You may have seen this product advertised online called the So Right. Joe Rogan has done some advertising for it. Oftentimes that muscle's tight. I don't know that I would give it so much credit that, like getting a So Right and laying on that thing is going to improve your health extremely. But again, I have not tried that. I would love to try that so you kind of see how that feels. I have had my iliopsoas released or massaged, and it is probably, aside from actually having a herniated disc, the most painful thing I've experienced. It sucks, so definitely pass on that if you don't need to have that done. You've also got your pectineus there. It's a hip flexor, but it also helps with some adduction. And you've got your adductor group, adductor magnus, big fella, major adductor of the hip. Depending on which fibers you're talking about, either anterior, posterior. Anterior fibers actually help with a little bit of hip flexion. Those posterior fibers actually help with a little bit of extension. People oftentimes, when they get out running and they're having to substitute or compensate using their adductors, a lot of times they'll wonder, man, why do the medial parts or inside parts of my thighs hurt so much? Well, it's because they've been compensating, or they've kind of built up some type of substitution. Adductor longus, again, it's an adductor. Flexor, internal rotator, and brevis. Longus and brevis, one is longer and one is shorter, believe that or not. They both adduct, flex, and internally rotate the hip. And we talked about rec fem earlier, but it's another hip flexor, but it also helps with knee extension. So all those muscles cross the hip. So the last little set of soft tissue stuff that I wanted to talk about were the ligaments. One of them I left off because we couldn't see it on the hip model. It would have been nice if I could have shown you on the hip model, just because I'm gonna tell a story about Bo Jackson. If y'all know anything about Bo Jackson, he's had some hip injuries, and it has to do with one of the ligaments in his hip. Those hip ligaments are the iliofemoral, the pubofemoral, and the ischiofemoral, and they all get their names from where they connect the femur to. Iliofemoral connects the femur to the ilium, and that's one of the strongest ligaments in your body. I think it's actually the strongest, and it prevents excessive extension at the hip. Doesn't let your leg go back too far, because that would be bad if you could do that. Just snap that sucker right off. Pubofemoral starts at the pubis, connects to the femur, prevents excessive abduction and extension. Ischiofemoral starts at the ischium and then connects to the femur and prevents, again, excessive extension. Now, the last ligament is the one that Bo Jackson injured, and that is the round ligament, and that connects the head of the femur to the acetabulum. You're thinking, wow, yeah, Bo Jackson injured that. Why is that such a big deal? Well, that round ligament actually has a large blood supply traveling through it, and that's the only way that the head of the femur gets any type of nutrition. So if that ligament is torn, that can cause what is called avascular necrosis. That is a bad thing to have, because if you get avascular necrosis or no blood supply, the head of your femur will die. And if you have any bone or any kind of type of tissue in your body and it dies, and you have to have some type of emergency surgery or corrective surgery at least to save that body part. In Bo Jackson's case, he was trying to shake a tackle. The gentleman had him by the leg, and he attempted to break that tackle by pulling himself forward, and in the process tore his very own Teres ligament, which is insane. That dude was so freakishly strong, he tore his own Teres ligament, or round ligament. That's just wild. And because of that, he had to have an implant. Bo now knows hip implant. All right, so I kind of mentioned this earlier, But much like the shoulder, the hip has a lot of working parts, which means, lucky for us, there's a lot of things that can lead to dysfunction or can lead to some type of injury or something being injured. And there are some common types of injury that occur at the hip. Much like the shoulder, the first most prevalent, you're talking about muscle strains. We've covered that in excess in other videos. You've got delayed onset muscle soreness, which is not a concern, and then you've got different grades of muscle tears that can all occur at the hip. I'm sure you've seen people or videos or even images of hamstring tear. I think I've shown one in a previous video. Hamstrings can be torn. I've worked with a torn glute before. I tore one of my obliques before preparing for a disc golf tournament because I was not doing the right thing and I was just really trying to throw way too hard. Another common injury is tendonitis. You can either have some type of gluteal tendinopathy there or out at the greater trochanter, or you can also have hamstring tendonitis, insertional hamstring tendonitis at that ischial tuberosity or that butt bone. Also, much like the shoulder, your hip has a labrum and that can be torn, and that has a lot of similar symptoms. Clicking and popping with pain in certain movements. It's essentially the same thing. It's not necessarily the peel back mechanism or a slap type tear as in your shoulder, but it is a tear of that labrum. You can also get bursitis at the hip, which is just as equally painful as what you get at the shoulder. It oftentimes happens at the greater trochanter. Any type of bony protuberance or bony prominence on your body that doesn't have a lot of meat between that bony protuberance and your skin, there's going to be some type of little bursal sac there to act as a protective cushion for that bony prominence. If you've fallen on your hip before, you've hit that before, maybe you made it inflamed, you got a little bursitis yourself, does not feel good. You can also have impingements at the hip. It's a joint. It is a ball and socket joint, much like the shoulder. You're going to have some of the same injuries. And impingements, they're a little bit different here though, just because of the wear and tear that you may put on your hips from so much weight bearing, and then maybe your own God-given anatomy, which you were born with. You can get stress fractures of the hip. They have varying degrees of severity and concern. And then finally, you also get dislocations, subluxations there. It's a pretty serious injury. Not super common, but it definitely can happen. And there's some other injuries that I kind of have lumped into some of those other groups that will be covered in other episodes. So those are not the only injuries that we will discuss, but those are the major injuries that can occur at the hip. And like in past videos, I think it's important that I highlight that there are normal aches and pains. For instance, you can sleep on your hip wrong. I sleep kind of on my belly and on my side at the same time, and I have one of my legs hiked up, just most comfortable to me. So it's flexed, externally rotated. Some days, if I've slept more sound than others and I've been in that position more and I get up, my hip is sore. And it's just because I've kind of overstretched them overnight. Does that mean I have a hip injury? No, it doesn't. Not unless my 4-year-old sneaks in the morning and surprises me and jumps on me and then forces me into excessive abduction, flexion, external rotation. Then maybe I could sublux or dislocate, but that didn't happen. My hips sometimes click and pop. Does that mean that I have a hip pathology? I have a labral tear? Potentially, yeah, but I don't necessarily. So what I want you to take away from this is there are normal creaks and pops and cracks that don't necessarily mean anything. Our bodies are not perfect. They're not. They got little idiosyncrasies and different things that are different about them. Our bodies don't follow the anatomy textbooks. So it's kind of ridiculous of us to think that they're all going to work perfectly and they're not going to have their own little quirks. Keep that in mind as we go through this series. Now, when should you be concerned? In a previous video, I outlined that we use the visual analog scale a lot in physical therapy. And that means on a scale of 0 to 10, 0 being no pain, 10 being, I'm about to pass out, take me to the hospital, how would you rank your pain? If you were getting pain production with certain movement in your hip, where you have a certain pain in your hip, that is a 4 out of 10 or higher with normal everyday activity, that should be a concern to you. 4 out of 10 is beyond that annoying pain. It's getting to, okay, that kind of hurts, and I'm not really doing anything special. Why does that hurt? Maybe that should be a red flag for you to get that checked out by a professional. If you have pain that is lasting longer than 2 or 3 days, if you do something, you go out and play around, and your hip is still hurting, 5 days later, that should be a red flag to you. You should get that checked out by a professional. If you get clicking or popping in your hip and it's painful. Clicks and pops that are accompanied by pain, I don't like that. That you should have that evaluated by a professional. If you have night pain in your hip, either when you're laying on your hip or when you're not laying on your hip, if something about laying down or being in a supine position on your back or on your belly or on your side or whatever bothers your hip and it's painful, that to me doesn't make a lot of sense. If it's just sore by the end of the day because you've been on it a bunch, that's a little different than just night pain. But if you're laying in bed and you can't sleep because of hip pain, you should have that looked at. That's not worth losing sleep over. If you have noticed a marked decrease or a significant decrease in range of motion and or strength at your hip, following like a fall or overexerting yourself in some way and it lasts, 5 days, or it's just kind of gradually set on and it's not getting any better, go get that looked at. That's not normal. And finally, if you have a decrease in strength in your hip and it's accompanied by pain, that is painful and weak, definitely go get that looked at. It could be tendinous, could be something else, but you're definitely wanting a lot of the time to be using pain as a barometer. So if you have pain and weakness in the hip, it would be worth your time to get that looked at. That's just a brief overview of some of the things we're going to be getting into as we get through this series. I'm not sure how many videos long this series is going to be or how long it's going to take, but there for a while I had some downtime. I wasn't as productive as I had wanted to be, as we'd kind of been doing the quarantine thing. I was working on some other projects, but now that I'm kind of getting back into work in the clinic full time, it's going to kind of be the same process. I release videos just as I'm able. If you have any questions in the meantime, please reach out to me either through the Facebook page, through Instagram. If you're not following us on Instagram, follow us on Instagram. We got some cool stuff going on. We're going to start doing more giveaways and freebies through Instagram, or you can ask questions through the comment section under this video. So again, please stick with us. I hope this is going to be really helpful and informational to you. If you have a specific question about hip injury that you would like to see covered in this series, now would be the time to leave a comment or reach out to me directly to say, hey, I've got this going on. You didn't really mention that, or are you going to get to that? Maybe I am going to get to that, and I'll say, yeah, we're going to cover that. We'll talk about that. Or maybe I say, hey, you know what? That's a good idea. I'll get into that a little bit, and then maybe it'll be included in the series. You never know. Thank you for tuning in, and as always, stay excellent.
Showstopper. Big swing, Bo's the man.
Hey, what's up, y'all? So the cartoon clip that you just saw, that is from a cartoon that I have been unable to shake from my mind since I started making this episode. That cartoon has been on my mind because it had Bo Jackson in it. So I want to do a giveaway based on that. First, I want you to go to Instagram. I want you to follow us on Instagram. I want you to find the announcement of this episode on Instagram and comment the name of that cartoon, as well as the name of the other 2 superstars that were featured in that cartoon. And the first person to do so will win this Lucid X Trespass. It's 171 grams, it's blue, it's beautiful, it's got a green and kind of gold marble double stamp. It's awesome. It could be yours. If you go, you follow us on Instagram, you name that cartoon and you name the other 2 superstars, be the first to do so. And I will announce who that winner is on Instagram as well as Facebook, so please do that. It's a free disc. What do you have to lose?